All right. Good morning, everyone, and thank you for your patience as we kind of are still letting folks in, but we will begin. So today is May 18th. Good morning to everyone. Our webinar today is Accessing VA Healthcare and Mental Health Resources. My name is Shereen Nuez, and I am a training coordinator with CalTAP in the Department of Veteran Affairs. So what I'm going to do to kick it off first is to kind of welcome you all and also just give you a little bit of housekeeping, provide some introductions, the agenda overview, and then one Q&A will happen. So first and foremost, please be advised that this meeting is being recorded and your consent is required. So participation in the meeting will act as your acknowledgement for the recording. Camera and microphones are off, as you have already noticed. This is to maximize bandwidth and to limit any distractions. However, if you are interested in asking any kind of questions, there is a Q&A function at the bottom or the top of your screen. If you hover your mouse there, you should see one of the icons for Q&A. Go ahead and open that and post any questions you may have there. There's also what's going to be called a chat function there. If you open that, resources will be shared by my fellow training coordinator, Jana Adams, who will be answering questions live in the Q&A or also reserving them for the Q&A portion. So I would just like to do a little bit of housekeeping too for online that we want to just let everyone know is that in the event of an emergency or any kind of necessary things, secure yourself and safely exit the premises or wherever you need to be to keep yourself safe. If you also get disconnected from this, go ahead and refer back to the information that was provided in your email and rejoin us utilizing that link. So as I mentioned before, with some introductions, joining me today is my fellow training coordinator, Jana Adams. Also, we have Kathleen Mink from the San Francisco VA. That is our featured speaker today, who will go ahead and review accessing VA benefits and also some mental health resources for you. So without further ado, we're gonna go ahead and get started for what CalTAP is and what we have to offer. So what exactly is CalTAP? So CalTAP actually stands for the California Transition Assistance Program. I normally don't read my slides word for word, but I'm going to go ahead and read this one because it's important to kind of really emphasize what we do and how we do it. So we are designed to inform, connect veterans of all eras to their earned federal and state benefits, as well as provide continued support and assistance as your needs change over time through 5 different pathways. We have core curriculum, education, employment, entrepreneurship, and service providers. Important little note for service providers there. That's more of us working with service providers within the community and how to best work with veterans or how to access community partnerships with veterans and community partners. We have also what's called the Veterans Resource Book. This is an amazing tool which is meant to enlighten, educate, and empower you on your benefits, state and federal. Jana's dropped a copy or a PDF copy actually for you to download in the chat. I would highly suggest for you to have that so it's readily available for you either on your phone or on your access there so that you can be able to read and review whenever you wish what your benefits may be. This is our Calvet website. So to get to this webpage, you would want to go to calvet.ca.gov, and this will take you to our landing page. As you can see indicated by the red circle, that is CalTAP link, which will drive you over to us. So essentially, this gives you 24/7 access to CalTAP and our resources on what to learn more about your benefits and services. Let's go ahead and explore that webpage. So as I mentioned, those 5 pathways, they are located here, and it's embedded with a lot of great material and training resources, whether they be modules or even videos for you to read and review. So keep in mind, your needs may change 5, 10, 15 years from now, or even next month. Know that this is a great snapshot of how you can utilize your California benefits. We're going to go ahead and explore the core curriculum pathway. So as you can see here, this is what a module, or if you go into any pathways, what it's going to look like. There will be several modules in there for you to explore. We are going to go ahead and jump into the California benefits one. So what exactly are your California benefits? So we have 3 right here, one of our most popular ones being the college tuition fee waiver. So this is a dependent benefit. So that means that dependents of veterans with service disability rating of 0 or higher could qualify for the tuition fee waiver. In addition to that, we have DMV has provided also some great resources and also eligibility for certain things, such as the veteran designation on your driver's license. That way, you don't have to be carrying around your DD 214, or if there's a any kind of place or discount that you may receive indicating that you are a veteran, you have that on your driver's license. We also have the motor vehicle registration fee waiver, and you also can get customized license plates. All of that is facilitated through the Department of Motor Vehicles, and you would actually need to partner with your county veteran service office, which I will review a little bit later on how to obtain that paperwork. You'd want to go to them first before you go to the DMV, because I know how much we all love going to the DMV. Appreciate all their hard work over there, but we want to save you the extra trip for that. So I'll give you a little bit more information a little later in my presentation. I also want to remind everybody that in the chat, Jana is continuing to post some information about these items, so please keep track there. The Department of Parks and Recs has a Distinguished Veteran Pass, and the Department of Fish and Wildlife has special days for military and discounted rates for disabled veterans. We have also potentially tax exemptions, which may pique anybody's interest here. There's multiple counties throughout California, so it's important that you want to speak to your county assessor to determine what eligibility you may have, depending on your service-connected disability rating, on those exemptions you may qualify for. So a little bit about CalVet. We are composed of 6 different divisions. Myself and Jana, we are a part of CalTAP, which is housed actually under Veterans Services. And we are essentially a multifaceted unit whose goal is to best assist service members, veterans, and their families, and service providers to work and partner with veterans on a culturally competent level. We also have a home loans division, which is wonderful for those of you interested in buying a home or becoming a homeowner. It's important to know that the VA home loan and CalVet home loan are completely separate programs. And it has different qualifications. However, you can maximize your purchasing power by utilizing both. So visit our home loans division if you want a little bit more information or what you could be eligible for as far as loans that we may provide. We have an amazing women's division, and believe it or not, they're in California. There are over 163,000 female veterans. We are providing a link in the chat for the women's veteran roster, which will allow you to get on their mailing list for great information for upcoming networking events and or just events for our women veterans. We have a minorities and underrepresented veterans division as well. California actually estimates that of the veterans here in California, there are 47% that recognize as a minority. So this division seeks to identify gaps and increase accessibility. They also recently developed a great program called Pathways to Citizenship. So it's for those that are seeking citizenship that have recently served. Jana's already providing a link in the chat as well for more information about that. And then also for those of you may considering currently or even down the road for the future, we have homes for long-term care. This is income-based skilled nursing and assisted living facilities that provide recognized premier care that are located all throughout California. In addition to that, we also have our cemeteries in which California vets are eligible to apply for internment as well. We have 3, one in Seaside, one in Redding, and also one in Yountville. It's important to note, though, that the Yountville cemetery is actually reserved for residents of the Yountville home. So I know we've given you a lot of information, and I don't want to take up any more of your time. I'm going to go ahead and move on to their other presenters, but this is a great way for you to maintain your contact with CalTAP and with CalVet at that matter. So provide your non-DoD email at that email address there. We check it on the daily, caltap@calvet.ca.gov. We will not spam you. It's merely a way for you to just get on our mailing list for our newsletter or even any upcoming events like the one that you're attending today. You can also register for My CalVet on CalVet's homepage, add CalVet to the various social medias that we have listed here. And as I mentioned at the beginning of my presentation here, This video is being recorded. Much of our previous material is uploaded to our YouTube, and you can always review it there. So if by chance you missed something today, you can always rewatch it there. And lastly, we also have a survey. We take our surveys seriously, and we also greatly appreciate any of the feedback that you might share with us, so we can always improve our outreach or tackle any kind of topic that you might want to learn more about. So a little quick overview. This is how you would get to My CalVet and how to register, as indicated with the red circle there. This is an example of what our monthly newsletter looks like, with a special message each month that features our theme for each month. This one is about VA medical or health options, and in addition to that, a mental health aspect. Our deputy secretary also provides a personalized note, and then it also provides you a little bit of information of our upcoming in-person and virtual workshops. And lastly, we don't want to forget our great partners over at the VA. This is an example of their landing page, and the 4 different areas that they kind of provide information for you and access. I think Kathleen will probably go a little bit more information about that, so I won't breeze too much over it. But essentially, you can review any of your eligibility in healthcare, disability, education, and also your records. So that's it for me. As far as this is my contact information, as far as what I had to offer and share with you about the little bit of the California state benefits for veterans out there. I'm going to go ahead and move forward. I do have a few brief slides. Unfortunately, our link wasn't able to join us today, but I'm going to go ahead and tackle their slides. So Link is also known as a local interagency network coordinator. And you're probably like, who am I referring to? Well, I am referring to the 8 people that encompass this wonderful, colorful map here. These are our community partners. As you can see, they're located all throughout California. So wherever you may be joining us in today, this is a snapshot of the people that you can directly contact if you have any kind of information or would like to partner with someone in the community, or you're starting square one and you'd like to just get in contact with someone about your benefits. These are some great resources for you here. As I mentioned, they can't join us because they are, much of them are actually being stationed or dispatched at any of the DRCs or the disaster relief centers across California. I know some people are still recovering from the floods, and now we're also going to be turning around and gearing up for wildfires. And these links are the people who get out there and they help our community partners and then also veterans in their local area. So as I mentioned here, what they do, they provide outreach to service members, veterans, and their families. They also make referrals to established and vetted service providers. These will make sure that you aren't going to go to someone that's going to charge you an exorbitant amount of money to make a claim, because you shouldn't. These are earned benefits that you have that you should not pay for. And they will make sure that you go to a trusted community partner to get you assistance. They also assist with local emergencies like the disaster relief centers I just mentioned. And then also they provide leadership and advocacy to local communities. So whatever might be impacting you in your local community or needs some advocacy, you can always reach out to the links to provide support or a little bit of guidance in there. As I mentioned earlier, connection to benefits. They partner with the EDD, the Employment Development Department, and also America's Jobs Center of California. Those actual two, they usually are housed under one roof, depending on wherever you may be, and they help out with veteran hiring. There's actually a veteran specialist within each of those offices or the field offices to assist you in employment. So if you're seeking employment or training, you can always partner with one of the links to get the contact information for your local EDD or AJCC. In addition to that, I mentioned County Veteran Service Office or CVSO. They have countless connections with all the different counties throughout California. There is a dedicated CVSO, and our link is connected directly with them or knows who's within that county. They're the ones that file and assist you with file your claim and assist you with that. Or even if you have any kind of questions about discharge upgrades, they can assist you, or just any kind of medical claim or even educational assistance. They help you with that. Again, CalVet, as I mentioned before, is a state benefit. We also have healthcare as far as the VA medical centers and clinics, and also vet centers. So if you want to hold up your phone if any, if you'd like, you can take a picture of the link that might be in your area. This is the list of all 8 of them. If you have any questions, this slide will come back up again towards the end of the presentation, so that if you have any questions, you can always email them directly, for wherever you may be, about any resources that you are seeking. All right, without further ado, I would love to bring on Kathleen Mink, our featured guest speaker for today, as she's going to be reviewing how to navigate VA healthcare.
Thank you so much, Sherry and Jana, for having me, and thanks to everyone who's joined in today. As I do want to highlight, there is a Q&A, so if I go over something and you're not quite sure, want me to repeat it, definitely put something in the Q&A so I know to go back to it later. And so yeah, I am part of the San Francisco VA and part of their veteran outreach program, currently student veteran outreach, and then I do help with hospital-wide outreach to veterans. The VA system is huge, so we'll try to make a little sense of it today. And I also have my contact information on one of the later slides. So if you need personal assistance, I can help with that. I don't know if I could go to the next slide. Thank you. So I like to pull up this slide because I think there's a little bit of some misinformation about how the VA works. So the VA has 3 branches, and this, when I say the VA, I'm talking about the federal system. So federal Veterans Affairs. So we have the Health Administration, and that's where all the VA hospitals, vet centers are located. And that's the branch that I specifically work for. When I think about this branch, I think about services. So doctor visits, mental health, dietitians, podiatrists, anything that's sort of health related that you get services for will likely be under the Health Administration. The Veterans Benefits Administration is where your disability claims go, VRNE, or Veteran Readiness and Employment, home loans, compensation, pensions. So I think of that branch as anything having to do with money. And these two, I think, get mixed up a lot. So sometimes someone will do a claim and they get really frustrated with the claim process and they think, oh, it's all the VA. So we have people who access healthcare, also go through the claims benefits. And there are connected in some ways, but very separate. So if you are having frustrations with the benefits side, that still might not prevent you from getting health services that are really important for your well-being. And then the third branch is the Cemetery Administration. So hopefully we will not be using them anytime soon, but that is a branch of ours. And we have cemeteries throughout the United States that you can apply for. And we also do have the Veterans Crisis Line. They just recently changed that number to 988. I definitely recommend keeping that or knowing that there's a chat option, phone calls, and that's a 24/7 line. You don't have to actually be in crisis to call it. If you have just questions about benefits or need resources, they can often connect you with a local VA to assist you or to give you resources in your area. And then the My VA 411 is a number that you can call, and they basically route you to whatever branch of the VA for benefits that you need to be in. Next slide. So VA healthcare, what does it mean? And there's one of the misconceptions that I hear a lot is that I don't have any disabilities, so I can't get healthcare. And the truth is we have a lot of veterans who qualify for VA healthcare that don't have any injuries, or at least they haven't filed a claim for any injuries. And so what we would refer to as a non-service connected veteran. And that basically just means that they don't have a disability claim or an award for a disability. But we have tons of veterans who actually go to the VA and get all their care who do not have this disability rating. The VA does offer primary care, preventative care, mental health, and I'm not going to go through this whole list, but it's pretty extensive. We have social work services. We have a dental insurance program that we provide for veterans who are enrolled in healthcare. Dental is one of those services that we can't provide to every veteran. It's just simply we don't have enough dentists to do 2 cleanings for every veteran in the United States, but we do have a program that the VA helps pay some of the premiums, so you have less expensive options. We do have emergency services, surgery, so anything that you might find in another insurance or your private insurance, the VA typically has it and sometimes has even more benefits beyond that. Next slide. And so the VA, and because I'm located in San Francisco, I just want to give a tiny overview of how the VAs typically work. So you have big medical centers, and in our case, our big medical center is San Francisco VA. We're located in San Francisco, and we have small clinics that are associated with it. So I kind of think of San Francisco as the mothership, and then all of the small clinics that are associated with it, where you can get primary care that are embedded into the community. So San Francisco, we have a clinic in San Bruno, but we also cover all the way up to Eureka, basically next to the Oregon border. We are sister stations with Palo Alto, who covers south of basically San Francisco Airport all the way to Monterey, across the bay to Livermore, and then Northern Cal, another one of our sister programs that's based in Sacramento. So we kind of cover all of Northern California toward Nevada and up to Oregon. But if you're looking at any VA across the United States, you'll usually find a main medical center and then the corresponding community clinics affiliated with it. All of those centers will have, like San Francisco, you'll have a chart there, and all the clinics, you'll have a chart available. So if you were to move within that region, you'll be able to establish care. And if you were to move to another one, all you have to do is just have them download your information, so you can move and transfer care pretty easily through the VA. Next slide. If you're not quite sure what VA is closest to you, va.gov, I would go on there, and they have a little tab that says find locations, and then you can specify if you're looking for a health location or a hospital, mental health, vet centers, anything like that, and you'll be able to find that. But again, we have VAs across the United States into actually Guam, Philippines, Puerto Rico. So we have ones even not quite on the land-bound US. Next slide. So I'm going to preface this slide by saying it's a little murky. And so if you go and are trying to, I'll also say, I actually don't often go over this slide with that much detail, because mostly I want people to call me. There's a lot of idiosyncrasies about eligibility. So I don't want anyone to read this and say, well, I just don't qualify, because sometimes you do based on your specific situation. But as a general overview, this is how one might be eligible for healthcare. So for anyone who served prior to 1980, you just need at least 1 day of active duty other than training. In 1980, September 8th of 1980, they created this extra criteria. So for active military service, you need 2 years of active duty, or if you were discharged early, and meet an income threshold. And the income threshold was actually put in by Congress in 2001. I have a lot of opinions about that, but I will not share that today. But there is an income requirement. For reservist or National Guard, you have to be called up by basically a presidential order and complete that full activation period. And often we think of that as a Title 10 activation. And then also you would have to meet some income requirements. There's also some scenarios where there's some flexibility with eligibility. So there's Vietnam and Gulf War deployments that if you were on land, that often the income is waived. If you're service connected or you have a disability rating of 10% or higher, that actually waives the income threshold. The PACT Act, which I'll go over in a second, also opens up some eligibility, as well as if you were a POW, Purple Heart, or have a Medal of Honor. But again, just you can take a snapshot of this, but I would say if you're not sure about eligibility, reach out and we'll kind of sort through that. I hear a lot about veterans saying, well, my buddy didn't qualify, so therefore I don't. So it is really individually based. So even if your friends don't qualify, that doesn't necessarily mean you won't. It's always good to check. And I've had a lot of veterans who were told, even in the military, that they don't qualify. And we found that they were eligible for benefits and could start accessing care. So definitely reach out if you have questions about that. Next slide. There is something called an enhanced combat veteran status that we have at the VA. And that's if you served in a combat area, and this is post 9/11, when this sort of started, I guess 1998 specifically, but the way that combat veteran status works is if you were in a theater or active duty in a combat after 1998, November 1st of 1998, and you were discharged after 2003 and didn't receive a dishonorable discharge, you have 10 years to get into the VA system where they waive the income threshold. So that sounds super murky. I think that the VA had a campaign where it's like 5 years of free service. Basically, what I would say, if you served in combat, apply for VA healthcare as soon as possible. The PACT Act extended it to 10 years instead of 5. And that basically just means that the threshold for income is waived. And that's a big deal. The threshold for income varies from area to area. It does not take very much in some areas to be over the threshold. So if you are anywhere in the 10-year range of being discharged, and even beyond, if you were a combat veteran and discharged in 2001, apply now. The waiver is actually still in place. We can get you in now, and your income will not be a factor. And just to highlight this, I recently reached out to a veteran who was rejected previously from the VA because their income was too high, and we were able to get them in under PACT. So there's definitely a window, and I would take advantage of that. And when I say the threshold basically varies from county to county. San Francisco is fairly high at it's about 99,000 for a single veteran, but we have some areas of California like Fresno where it's in the 40,000 range. So you can see, even if you have a somewhat decently paid job, that the income could be a problem for you. So if you have any combat veteran status at all, or if you've served in combat, apply now. Next slide. And yeah, I mentioned the PACT Act, and you guys might have heard of the PACT Act. It came in last year, was signed by President Biden in 2022. So basically the PACT Act expands healthcare eligibility for veterans who might have been exposed to burn pits or other toxic substances. And that does not just impact post 9/11, it impacts Vietnam veterans, Gulf War, and post 9/11. So there's two parts of it that I kind of divide the PACT Act. So it's veterans who, for just getting into healthcare. So like I mentioned, it expands combat veteran status. So combat veterans who maybe were previously rejected from the VA, or are just now just discharged, they can get into the healthcare system and they waive the income threshold. For Vietnam veterans and Gulf War, there are still some expanded eligibility. And what we also are finding is that with the PACT Act is that it's authorized additional medical centers, so that we'll have more VAs across the United States. It also increases toxic exposure screenings. So every veteran who's had any combat status, or I mean, you can even request it if you're not sure whether you've been exposed or not. There's toxic exposure screenings, and then each VA has a environmental medicine clinic that specializes in toxic exposures like Agent Orange and burn pits. I talk to veterans often who for a year slept next to a burn pit. So we want veterans to come in, make sure that they're getting their care. Um, and I said this previously, but for combat veterans who are discharged between November 11th, 2001 and October 1st of 2013, you should enroll now, because they're still going to waive the income threshold until later this year. So at the beginning of the fiscal year, which is October 1st, that window is closing. So definitely, if you know somebody or you yourself are in that criteria or meet that criteria, apply now. It also expands eligibility for benefits for veterans exposed to toxic exposures in the claims part. So if you're looking at a disability claim or, uh, primarily the claims, it identifies additional presumptive conditions. So for Vietnam veterans, for instance, a presumptive condition is um, a card like hypertension. So to be honest, I don't know any Vietnam veterans who don't have hypertension. And the importance of this is that if you file a claim for hypertension, for instance, if you're a Vietnam veteran, and you don't have to show that hypertension was a result of Vietnam. They're presuming that anyone who was in Vietnam on land will likely have hypertension. So these claims are going to be probably much easier to get through the system, but we want them on your record. And that also goes for post 9/11 and Gulf War. We want these claims on your record, because if something happens to you down the line and you, heaven forbid, pass away, and it has something to do with a condition that you are service connected for, that opens up benefits for your dependents. So even if you're not sure you want to do it for yourself, it's worth talking to a county veteran service office to see if, one, do you qualify for any of these benefits, but also these might ultimately end up helping your family. And the benefits that the VA can offer, not only if you get a claim to go through and you get a disability rating, it opens up healthcare, it provides compensation every month, and it opens up some services for your family. So I definitely recommend. I will put a cautionary note. Please go to, if you're thinking about doing a claim in California, we're really lucky. We have county veteran service offices. We also have the American Legion. We have the Veterans of Foreign Wars. Please go to a well-established veteran organization. We have a lot of places that are sort of preying on veterans now, especially with the PACT Act, who are saying that they'll help with claims, and there's always a payment someplace. I know veterans who've paid upwards of 60% on their claims. That should be a free process. So be really careful about any contracts or anything that you're setting up with an organization that says that they'll help you. They might help you, but you will definitely pay for it. No one's doing any of that for free in those organizations. So definitely seek out a county veteran service office. And if you don't feel like the county that you're working with or that you live in is working for you, call another one. Most of them aren't very territorial. They can help, even across county lines. Next slide. So why should I enroll? So the VA has no enrollment fees. There's no annual premiums or deductibles. So, I'm not a veteran myself. I pay hundreds a month just to have health insurance. So if you sign up for the VA, even if you're not using it, you're not going to pay for it. And once you are enrolled, you're enrolled for life. And there's literally no other benefit that has that in the United States. So you enroll, maybe you have your own insurance right now and you don't feel like you need the VA. I would still enroll, because what happens if your job changes? What happens if something comes up and you need additional service and your insurance isn't going to cover it? You always can use the VA as a backup, but I just say, if you can get in now, because you will have that program for life. We do have healthcare systems nationwide, as I mentioned, and we have over 1,700 sites of care. We also have much more, especially since the pandemic, expanded telehealth. So sometimes you can just see your doctor via video. And I know for veterans who are in more rural areas, that's really a nice option. If you have somewhat decent Wi-Fi, you can often talk to your doctor either by phone or video. You can use it with your private insurance. You can get a VA ID card, which is really nice for discounts. And if you were to move, you just show that VA ID card, that health card, and you can get easily registered at other VAs. I mentioned the dental insurance program, and then we have other social work services and all that kind of good stuff available too. Next slide. So how to enroll? We have a number of ways you can enroll. You can enroll online, and I've put the link there, but if you go to va.gov and just click on the healthcare box, it'll show how to apply, and you can start the application right online. The other option is you can apply on the phone, which I actually think is a really nice option. You call Monday through Friday, 5 to 5, and that's Pacific Standard Time. Press 1, you'll actually talk to a eligibility representative who can do the application with you right over the phone. You don't have to necessarily send them anything. You don't have to sign anything. It's a really pretty streamlined way to get connected, and yeah, it's just right over the phone. And I have called that number a few times and have been able to get reached a live person every time I've called. I just find that maybe early in the morning on Mondays aren't the best time to call, but I've called at various times and been able to reach somebody. You can mail or fax an application. So you'll find the VA application, the 1010 Easy. You can just plug that right into Google. You'll find that. And you can fax or mail your application. You know, sometimes that's a preference for people. If you live near a VA, you can go in person and talk to member services. That office is either called eligibility or member services, and they can help you fill out that form. And the fifth option is reach out to me. I help veterans with applications all the time. Sometimes they set up Zoom, sometimes we just do it over the phone, but sometimes it's just hard to get through paperwork, and I can help with that. If you reach out, usually the application takes, I don't know, 15 minutes to get through at the most. So I can pretty much streamline that process if you're, find that paperwork's just not your thing, which I totally appreciate. Either way, like whatever you're doing, if you send your application in, please make sure you sign the application. The VA will not accept anything that's not signed. Again, if you apply by phone, you won't have to do any signatures. But any one of these ways is a great way to apply. And again, happy to help with anybody who wants to explore their eligibility. And next slide. So once you're enrolled, what will I pay for? So that's a question I get quite a bit. So there are co-payments that some veterans might pay if they go into the healthcare system. So any veteran who has a disability rating of 10% or higher will not pay for any outpatient, inpatient, emergency visits, any of that. So 10% or higher, you will not have any medical visit co-payments. If you're 0% service connected or you don't have a disability rating, your co-payments are either $15 for outpatient primary care or $50 for outpatient specialty care, and that's per day. So, so if you see multiple doctors in a day, you'll just pay one time. And if you are combat veteran status, anything that they think has to do with combat veteran status, you will not pay for within that period of combat veteran status. And then your co-payment status can change from year to year. So say 1 year you have a glorious year, great pay, you might have co-payments. Say the following year you lose your job or you leave your job or something happens, you have a lot of medical expenses, you might not have co-payments the next year. So my rule of thumb for veterans is if you get a bill from the VA and you're just like, I can't pay for this, don't stop getting care. Reach out. You can do hardship waivers. Sometimes we just need to update your means test for the year. there's payment plans. So there's lots of options that we just don't want people to not get care because they're worried about the cost of it. That's the worst case scenario. And you'll find with lots of people who aren't veterans, that's a huge concern. People avoid the doctor because they don't want to get the bill. And even with insurance, your bills can be quite expensive. So at the VA, we do not want you to come in and or avoid coming in because you don't want a bill. If you can't afford it, talk to us. Let us know what's happening, and there's usually workarounds. Next slide. For prescriptions, same. So with medications, veterans who are 50% or higher are not going to have any prescription copayments. And again, copayment status changes from year to year depending on income. The co-payments for medications, it's either going to be $5, $8, or $11 depending on name brand or generic. So that's for veterans who don't have any disability ratings up to 40%. $5, $8, or $11 is the max for a 30-day supply. So it's pretty comparable. I find that some veterans who have private insurance, they'll get maybe one of their insurance covers most of one prescription, but is really expensive for another one. So you can kind of use insurances together with the VA. So I've had some veterans have prescriptions set up through the VA because it's just a lot cheaper. So, I think there's a way to navigate multiple insurance options if you have them. Next slide. And so, enrollment, what will you pay for? So there are some things that for all groups you won't pay for. So counseling or care related to military sexual trauma. If you do a disability claim and have a compensation or pension exam, that you won't pay for that. If you're getting any care through a research project at the VA, you won't get charged for that. And I won't go through the whole list, but labs, a lot of equipment, actually, there's not a charge for. So we have veterans who sometimes need crutches, hospital beds, the sort of equipment. We actually don't charge for that. Anything related to a disability claim, you will not receive a copayment for that. So there's, if you ever get a bill from the VA, you're not sure about it, again, you can always call the billing, make sure that they didn't make any errors. But there's a lot covered by the VA that you don't have to pay for. Next slide. So I did want to go over some mental health resources. So the VA, of course, as I mentioned, the VA healthcare system, we have mental health options. So most VAs are going to offer individual, group, and medication management. San Francisco VA, we also have family and couples therapy. And when I say group therapy, sometimes people think, oh, I just don't want to sit in a room and talk to a bunch of other people who are depressed. That sounds terrible. That might not be your thing. But we have really amazing groups too. We have a surf group here in San Francisco. We have a group that works with Paws for Purple Hearts, where veterans come in and help train dogs. We have a women's craft group. So there's lots of groups. So I think, traditionally we think of groups as something kind of like, and then we all sit in a room in a circle and it's dark, and not all groups are like that. And so I think I really like those sort of process groups, but I think there's a wide variety across the VA. So I think it's worth exploring. We also have the vet centers. So the vet centers provide therapy, but do not provide medication management. So if you have depression or something that requires some medications, you can still see the vet centers if you meet their eligibility criteria, but you probably will need to get medications from someplace else like the VA or a private insurance. The vet centers, the eligibility is a little bit more exclusive. It covers combat veterans, veterans with military sexual trauma, and there's a few other criteria, but it's a little bit more exclusive, like I mentioned. The vet centers are part of the VA, except their charts and everything are kept separate. So if I were to know a veteran, I won't see their records from the vet center. Those are kept kind of in a different section, and we don't have easy access to those. So it's kind of nice to have a little extra privacy if that's what you're looking for. Again, we have the crisis line, not always used for just crisis, but that's a 24/7 line. And then other specific organizations that are veteran specific, they have Make the Connection, which is a really nice website. It has resources on there, but also there's a really nice set of videos that veterans talk about their own experiences and things that they have a whole section on student veterans and what that's like, the transition, and they have what it's like to go through PTSD treatment. And so it's a really nice, I think, from the veterans experience, tons of videos and information that I really like that website. Give an Hour and the Wounded Warrior Project both offer some free therapy options for veterans and sometimes even family members, that's given based on, you can look it up and they can find a provider, and then they can offer a certain number of therapy sessions. Again, that's not affiliated with the VA, but it's a community-based organization, and yeah, it's great because sometimes people don't necessarily want to go to the VA, and that's okay. We just still want people to get resources when they need them. And then other community options that I wrote, every county has a mental health service. If you're a student, definitely you can look to the campus health centers. Most of them will have some a set of options for individual therapy or even group therapy. I was, as the pandemic had come on, I've recognized more online or virtual mental health options like BetterHelp. Cerebral, I think, is another one. So if you're, again, whether or not you're don't want to go through the VA, you're not eligible for the VA, there's still some other options. Sometimes people just don't want to have mental health stuff at the VA. Again, that's okay. But if you're feeling like you need a little bit of help and support, which everyone does at some point, definitely seek out some of the various benefits that are out there. And for some reason, I can't quite look at the last option there, but I'm sure you guys can see the slide there. Next slide. So I just want to go over a few myths about the VA, and I think I might have covered some of them already. So myth number one that I hear a lot is the VA healthcare is only available to veterans who have service-related injuries or disabilities. And again, that's not true. The majority of veterans we see at the VA do not have a service-connected disability rating. I've been at the VA for almost 17 years, and that's actually something I've heard time and time again, where veterans were told at one point they don't qualify. They were told by their commanders in the military that they don't qualify. They were told by their buddy that they don't qualify, and they might not be eligible, but we always want to check. I've had lots of people be surprised over the years when they turn out that they are eligible. I mentioned it earlier. I had a Vietnam veteran who I enrolled just yesterday who was told at one point that he didn't qualify. And he spent 3 years in Vietnam, and he certainly qualified, and we were able to get him enrolled in one day. So he has healthcare through the VA available to him now. So again, the worst thing the VA is going to say is no, just ask. And I'm happy to help anyone through that process. If the answer is no, and I will tell you why. I think that's really important. Sometimes that gets lost in the shuffle with the VA, is that I'm told that I'm not eligible, and that you don't know why. If you were told that, let's look at it. And I want to be able to explain why. Sometimes, again, if you're not eligible because of income, if your income changes, that might change. So we always want to keep looking at this. So myth number two, which leads me right into that, veterans are only eligible for VA healthcare for a limited time. You're eligible for your entire life once you are in the system. Myth number three, I can't reapply because I've already been told I don't qualify due to income. And again, that income is based from year to year. So I've had veterans 1 year. I had actually an officer once who tried to apply, and we were going off of his income as an officer. He didn't qualify. He had a change of income, so we could do a hardship or a waiver for it. But we actually enrolled him in the next year. He was a student. He didn't make any money. So we were able to get him right in that January. So you can reapply if your income changes, if some veterans, their income hasn't changed, but they have new dependents, they had really high medical expenses, they had a surgery or something, and those all get factored into your income. And then the last one, which I think is really in line and comes up a lot because of veterans want, care for service is, if I use the VA, I'll take services away from another veteran who needs it more. And the truth is the more veterans we have using the healthcare system, it tells Congress that this is important, and they expand the budget. When we have fewer veterans using the VA, our budget shrinks, and we find that services can get cut, or we have places that aren't supported as well as they should be because we don't have the budget for it. So the only caveat I would say is that if you make an appointment at the VA and you can't make it, just cancel it, because if you cancel it, they can often get a veteran in your place. But if you just don't show up, then we don't have time to so often book another person. So in that case, I would say, just be conscientious of making appointments. And if you can't, cancel those. Next slide. I think it might be hitting the end. Yep. And there's my contact information on my phone and my email. I have those. My phone's with me constantly, and I do respond to emails. So feel free to reach out if you have any questions. I'm happy to go over all of that with you. So thanks so much. And I went over a lot, so please answer or ask questions as needed.
Thank you so much, Kathleen. That was all great and amazing material. I hope that everyone has taken away a little bit of information more about how to access VA benefits, most especially if you've been told no, that you should try again and not be discouraged within that. And that Kathleen's a great resource for that. At this point in time, I'm actually going to bring on my partner, Jana Adams, who has been putting stuff in the chat for some resources. In addition to that, have her take it away for any questions that there might be out there.
All right. Thank you, Cherie. And thank you so much, Kathleen. I got so much great information. I probably feel like every time I listen to you, I get more and more takeaways. So I appreciate that. We do have 3 questions that came in while you were talking. So the first one asked, what VA services are available to veterans overseas, i.e. Germany and the EU? What ID is required?
So if you have VA healthcare, it's somewhat limited if you are in the EU. If you have a service connection or service connected disability, you can get something called like a foreign medical coverage. You'll have to notify the VA where you're traveling or where you're going, and when you're going, and they can often cover and make sure that you have no charges based on anything that's service connected, but it is going to be much more limited. I can send you some information or a link to the foreign veterans if you want to put your information someplace. I can get that, like a link to kind of how to access that and what the process is for foreign medical, but it's definitely much more limited. The VA tends to be veteran focused and United States, with the exception of a few sites, like I mentioned, in Manila and Guam, Puerto Rico. So, yeah.
Great. Thanks for answering that. So for the person that asked that, if you wanted to, you could put in the question answer your email address, or you could also email Kathleen directly and say, hey, can you send me that info? And she'll get that over to you. Okay, the next question is, I was medically retired in 1978. Is there a medically retired ID available other than the one I have now?
I don't know that there's a medically retired one. I mean, a medically retired one would typically come from DOD and not really the VA. So, I mean, I don't know where you're located, but, send me an email. We can find out. I can call one of our local kind of DOD sites and see if there's something that they can update. The VA does, like I mentioned, have a VA ID card, and that typically shows a service connection on there, but the DOD medically retired ones, I'm not 100% sure, but I will ask and let you know.
Thank you for answering that. So the next one is a little bit specific, so I'm not going to read the full question completely just to not give out too many details for the person, but this was a slide when you were going over some of the different medical benefits that you can get. Someone said, I see that there's a no pay for surgeries. She's needed to get a particular surgery for 6 months now. How do you get the surgery if no one will operate on me? And I can't get an ortho appointment. I've had my shoulder in 4 pieces and walked it off now. How do I access that part? That's the difficulty I'm finding, not registering for care or finding facilities, but actually receiving care when referred to or necessary.
Yeah, so for ortho, typically you're going to get the referral from your primary care doctor. That starts up the referral. And if they can't provide that, the surgery, or they don't have, if say you can't get an appointment because that's scheduled out, if you want a second opinion, you don't feel comfortable with the VA, you can ask for a community care consult, and the doctor can put that in for you. Often we provide that or offer it if the VA can't offer an appointment within a certain amount of time. But there's also some situations where, hey, I want a second opinion about something, or hey, I don't feel comfortable going to the VA. So also feel free to email me if you have questions. Specifically, I know that question was a little bit more detailed, but yeah, one option is looking for community care referral, which your primary care doctor can put in. And that may or may not, and all of these may or may not be answers fully, or they are answer-ishes. Just email me and then I can kind of deep dive closer and like more into your specific question.
Okay. Can you get prescriptions only, or do you need a VA MD? And is the $700 a deductible or a total of meds?
So so if you have a prescription, you'll want to get the prescription approved by your VA doctor. So what I usually say is like establish care with the VAs. So just get one appointment, do a physical once a year with the VA. And then if you have medications, you can get those. If your doctor at the VA agrees with those medications, you can get them through the VA. But you'll need a VA doctor to prescribe it within the VA system. Otherwise, we just have a bunch of doctors sending prescriptions. And the VA wants to, for liability reasons, that we want to make sure the doctor knows what they're prescribing or what you're on. So yeah, I would say see a VA doctor. The 700 is a max. So if you were to get medications and say at some point you have a ton of medications and you've been paying co-payments and you hit a 700 mark, after $700, you're not going to pay anymore for the remainder of the year. So 700 is the max amount that you'll pay per year for medications. Anything beyond that, you will not have co-payments for. But definitely, if you're using or you are signed up at the VA, just at least see the VA once a year, even if you have a doctor on the outside or a different community. You don't have to switch all of your care, just be seen once a year. That way you have a team that kind of owns your care, and it's easier to access benefits if you have a doctor who's taking care of you already. We have a lot of veterans who show up at the VA in crisis and they're like, want something really fast. And it's hard to do that when you don't have a doctor. Like, it's just a little slower in those situations if you haven't been seen before.
Okay, definitely understand that. It can be slower. Let's see the next question. Okay, I received an other than honorable discharge, and was in prior to 1980. I recently lost my job. Would I be eligible for VA healthcare?
You might be. I mean, send me an email. Let's figure it out. We can look at your, I can have them look at your discharge papers. And then if we find that the other than honorable gets in the way, there's actually workarounds sometimes for that. But yeah, send me an email. And if you can send your discharge papers along with it, I'll have member services look at it and then we can kind of figure out next steps. But you very well might, I think the dishonorable is the biggest issue. Other than honorable, there's a few different things that member services needs to look at. And again, even if you still don't qualify, there's a workaround that sometimes the County Veteran Service Office can help you with.
And you make a really great point on that. I mean, and I'm actually really glad this person asked that, because I'm sure this is a really common question that maybe people are maybe nervous or don't want to ask, but the best thing to do is just to see if you can qualify. I mean, all they can do is say no, right? So
Yeah, and sometimes when someone has an other than honorable, then there's like for VA purposes, there's a distinction that's actually made through the benefits office that
mm,
it's other than honorable. Well, what does that look like? And so there's a few different categories, and sometimes we'll find that for VA purposes, it's honorable, and so again, it's very personalized to the person. So yeah, send me an email and let's figure it out. Because if you lost your job, we definitely want to make sure you have some coverage someplace. And if you don't qualify for the VA, then we'll go over some options that are California based that might be able to help you.
great. Okay, so just one more question currently right now. It reads, I have a VA card with payment for services required due to income. I served in a combat zone as recalled reservist in 2003. Does this change my status?
It might, yeah, it might change your status to be kind of reformatted under like a combat veteran status. So yeah, if you can, again, send me an email, let's connect, and then we can take a look and see what's happening in your record. Even
Great.
if you're not enrolled in the San Francisco VA, I can often ask member services to look up people and kind of figure out what the status is. If you're under combat veteran status now, often that gets updated automatically in our system. So, we can see, worst thing they're going to say is no, but might as well take a look. But yeah, send me an email.
It seems like the theme of these questions is, it sounds like a really great question. So email your direct scenario to Kathleen so that way she can see if she can help you out. But that's it for right now. Oh,
And I
wait, hold
think,
on. I
yeah, I
think
think
maybe one more just came up.
if you want assistance submitting a claim, County Veteran Service Office, I would go through them. I mean, it's free. Often they're veterans themselves. 99% of the time they work on claims. So even if you think about doing a claim, they often will make sure they do a head to toe with you, kind of figure out what's going on. They can track it. They can prep you for comp and pen exams, but the claim process, I have seen veterans do it on their own. I still recommend going through the County Veteran Service Office because the VA is pretty particular. So if you miss something, they can send it back and it prolongs everything. It's a free program, so I would definitely reach out to them. And since COVID, a lot of the offices actually offer virtual appointments too. So you might not even have to go into an appointment. You could look on their website specific to your county, and they will help you out.
Great. And I just put the website where you can actually find your CVSO or County Veteran Service Office on our CalVet website. Or you can just call our 800 number and someone from Cherie or my team or one of the links will answer the phone. We really actually answer, and we'll find a location for you. So it's not a problem. So, oh, wait, I think another one came in. Sorry. Hold on one sec. We'll get to that.
Oh.
Okay. A complicated question is going to email you. Perfect.
Okay,
Do
good.
that.
Yeah, perfect.
Okay.
Yeah, thanks for all the great questions.
Yeah, thanks for answering them. I'll turn things back over to you, Cherie.
Answering-ish, let's
yeah,
just say.
yeah.
If anything, I think the questions that you answered also just to kind of lay the ground of like if anything that I'm thinking of, to kind of get people started without revealing too much of personal information, as this is a public forum. But I do greatly appreciate everyone that has asked questions, and Kathleen, the great information that you've provided. Again, I have all the contact information here, so if you haven't done so already, get your camera phone out, take a picture of this so that we can all keep in touch. Kathleen's information is there along with myself and Jana's. And then also, if you are looking to connect locally within your county or region, our links are great assets. Even though they're out currently at any of the disaster relief centers, they are still readily answering their phones and then also their emails. So quick thing for us before we conclude the presentation, we do have a few upcoming webinars left here in the month of May. On the 24th, we have Women and Minority Veteran Resources. On the 25th, we have Veteran Healthcare Options. So for those of you that aren't already enrolled, I would suggest attending it and seeing what kind of healthcare options are out there for you and for your dependents. I believe that they're going to be going over information on TRICARE and CHAMP VA as well, and a number of other different resources that might be covered. And then lastly, on the 30th, we have a mental health and veteran resiliency webinar. All of this can be found on our Eventbrite page where you registered for this event today. Or if you would like to scan the QR code provided on the slide, you can do so as well, and it'll take you to our Eventbrite webpage. It'll also include upcoming events in June, which I believe the focus is employment. So those of you that are seeking employment or looking to further develop your career pathway, I would highly suggest checking out any one of those outreach opportunities. And lastly, to conclude with you all, please, we greatly appreciate your feedback and value it immensely. Go ahead and take a snapshot of the hyperlink there, or go ahead and scan that QR code. It'll take you directly to our Survey Monkey on any feedback from today's presentation. And finally, thank you all for your service, and thank you all most especially for your time, and also Kathleen for your time today in presenting. We greatly appreciate it, and we look forward to hopefully seeing you all soon in the future at our next webinar or in-person event. You all have a great rest of your day.